This is part 2 of chapter 26, the viral infections of the nervous system. So we're going to go through these guys. We're going to talk about some arboreal viruses, West Nile and Zika. Remember that the term arboreal means that it's vector-borne, so some kind of insect usually transmits the disease. In both cases, it's mosquito. Then we have rabies and polio, and then we have a very interesting disease called transmissible spongiform encephalopathy, which is caused by a protein, which is called a prion or prion. I've heard both. All right, so here's arboreal encephalitis. So this is where our arbovirus has got its name, arthropod-borne. And a reminder just that many viruses can cause meningitis, like herpes, the flu, the measles, the mumps. And most cases of viral meningitis versus bacterial meningitis, bacterial is way worse. Viral meningitis is not as bad. All cases of meningitis are bad, but it's if these, they can spontaneously resolve, which is not true of bacterial meningitis. So how are these arboviruses? They're usually found in tropical climates. How are they moving to other regions of the world? For two big reasons, right? So we have a lot of environmental change due to climate warming. Usually these tropical areas, right, they're very warm, they're very wet, and that warming and wetness is changing on the planet. So we have the vector, right, whatever the mosquito is, that carries the disease, it will move into areas that are getting warmer, right, and getting more moist. So that that's occurring. Also, just a word on deforestation. When you cut down a whole forest or a big swath of forest, what you're going to leave is a bunch of clearings that are muddy and have, after rain, it can cause lots of puddling. And then the mosquito larvae, that's their nursery, right? So the mosquitoes go to water, they lay their eggs, and the larvae are found in that water. So the more nurseries or puddles that you see, the more mosquitoes can arise from there. Another thing is basically how we are traveling so much, right? Increased travel around the world, commerce around the world, people that are infected, animals or vectors, they all can spread around the world. And so that's why we have a prevalence of arboviruses that were confined to the tropics now in the United States and elsewhere. So arboreal encephalitis, we looked at this before: high fever, chills, headaches, vomiting, diarrhea, restlessness. In the elderly patients, it's deadly. Severe arboreal encephalitis, convulsions, coma, and death. So the first one we have here, we're only talking about two. I know there's a lot in your textbook. West Nile virus. West Nile virus is found in birds, especially crows, ravens, and jays. So that's why I have a picture here. And it's transmitted by a specific Culex mosquito, which is here. There's several kinds of them, really long legs. And this mosquito tends to bite birds and other birds, but every once in a while it'll bite a mammal, right? So that if the bird has the West Nile virus in its blood, then it can transmit it to the mammal. So again, this was endemic to places like Asia, Africa, and the Middle East. But in the United States, the first case was in 1999, and then by 2004, spread all across the country, and it's now considered a reportable disease. So the nice thing about West Nile virus, if there's a nice thing, right, that the majority of people who get infected with it do not even know. That 70 to 80% are asymptomatic. When you have symptomatic cases, it's mostly mild and flu-like. And then sometimes, right, that unlucky 1% will develop that severe and sometimes fatal encephalitis or meningitis. So the mortality rate, if it does get there, is around 10%, which is very high. The downside, no antiviral drugs to treat these viruses. So we're relying on your immune system to take care of it, and we have supportive care for your symptoms. The next virus is Zika. This one hit the news recently. It is also an arboreal emerging disease because it was endemic to not America, right? So Africa, Southeast Asia, South and Central America, but its range is expanding, right? Because the mosquito, wherever the mosquito is, you're going to find the disease. And Zika comes from a forest in Uganda where it was first described. So reservoir, primates and humans. Transmission is the Aedes mosquito. We looked at the Aedes also for malaria. These are the primary vectors, but you can also get it other ways like sexual contact, through pregnancy or blood transfusion. And mostly, again, a mild disease. So this Zika virus really became big news because of what it does to the pregnant woman. So the fetus, depending on what stage, right? So that's mentioned here. Depending on what stage that you get infected with the virus, if it's early on in development for the woman's fetus, then it will cause more issues because at that stage, you're really making organs and creating all those really important structures in the body. And then later on, when those structures are formed, it causes less damage. But one of the hallmark signs of Zika virus is microcephaly, which is an abnormally small head, as we can see here, small head for the size of the person. And if you just read this, I looked this up, it's all over the place, just depending on how severe the virus has been on the baby. So you can have anywhere from reduced life expectancy, developmental delays, to normal development and life expectancy. Unfortunately, the heads do remain smaller for their whole life. And so they'll have this condition for their whole life. And so they need to treat the condition for that life. And there's no way to enlarge the brain or head in this case. All right, our next virus is rabies. Rabies is caused by a rhabdovirus. This is considered a zoonotic disease. So it's, animal disease primarily. Wild animals and domesticated animals can carry this disease. Raccoons and bats and skunks, foxes, and then we have our domesticated animals as well. The transmission, as we probably all know, rabies is from a bite of an infected animal. The rabies virus is found in their saliva. There is a low incidence in the United States for rabies because we vaccinate, right? If you have a pet, we definitely want to make sure they get their rabies shot. For dogs and cats, interestingly, they do have a vaccine for wild animals, and what they do is in areas where they know that there's been rabies, they will drop food that have this oral vaccine in it into those areas, and hopefully those animals will eat the food and get vaccinated. So the incubation time for rabies ranges weeks to year. And again, the bite leads to the peripheral nerves, and then from the peripheral nerves, it moves up to the central nervous system. So the bacteria gets into the brain, encephalitis of the brain. The virus, what it does is it blocks neurotransmitter receptors, the neurotox. So basically when it blocks receptors and it doesn't kill the cell, right? We looked at this with botulism too. It's not something that harms the neuron. The neuron doesn't die, but it just blocks the action. It blocks those neurotransmitters. So we use neurotoxic instead of cytotoxic, because cytotoxic means the cell is getting damaged. So it continues to spread to the central nervous system, and then it does find its way to the salivary glands. And in the salivary glands, the virus is released. So early stages of the rabies. So you can see there's two late stages. The early stage is going to be malaise, being tired, headache and fever. Then you have acute pain, and you can have violent movements, uncontrolled excitement. This is also seen in animals, right? They get very excited, they're very agitated. And then they have a very interesting hydrophobia, so a fear of water. And so the fear of water is actually kind of interesting because they don't want to drink the water. They have trouble swallowing as well. So the saliva sort of tends to build up in their mouth, which is why you have that frothing of the mouth, which is one of those things you see with rabies. And so the patient may experience periods of mania, right? And lethargy, so up and down. But rabies is always fatal. So if you don't treat rabies, it will 100% kill the person who's a person or animal that's infected. In the late stages, so these are the early stages. In the late stages, there's two forms. There's furious rabies, which is what we're sort of talking about now. You get very agitated and hyperactive. You have this fear of water. Even thinking about water makes you want to bite something, which is kind of funny, right? But it's very serious. So you have excess salivation because you can't swallow. You have muscular spasms in the throat when you're trying to swallow, and extra salivation and a desire to bite. So you can see how the virus is really very good at getting from one animal to another. It not only it goes to the salivary glands, but it also changes your behavior to bite another animal. Then there's paralytic rabies, which is, as you would think, you're going to be paralyzed. And the paralysis slowly spreads throughout the body. And then the paralytic form can culminate in coma and death. And for rabies, we know that it's the toxin. I'm sorry, we have an anti-serum and a rabies vaccine, not a toxin. The anti-serum will be made against the rabies virus, and then the rabies vaccine is also given. So to treat, right? So immunizations, it's kind of interesting because you would think like, oh, what does it, if you already have rabies, why would they give you a rabies shot, a rabies immunization? Because rabies is a very slow growing, right? So we remember that we have several weeks to a year of incubation time. So it's not a very fast growing virus. And if you give someone a vaccine, you'll actually make antibodies against the virus faster that way than to develop them due to the infection. So vaccines are used. And then if you also want to probably get immune globulins, which is an anti-serum, again, the passive immunity. So you're going to be given antibodies along with the immunization to create your own antibodies. Down here, I just have a little chart mentioning that in California, right, the primary animal that has rabies is our skunk. So our little flower is infected with rabies. Oh, this is polio. Okay. To begin poliovirus, I didn't title this, but this is basically some images of polio in the United States. This is an iron lung. So people who have respiratory issues that can't breathe because of the polio. Polio is another virus that impairs motor function. So it does affect the skeletal muscle. And so you can see if it's breathing muscles, you have to have a positive pressure machine breathe for you. And then if it is a skeletal muscle that controls your body, right, you can become paralyzed with this polio virus. So the disease is called poliomyelitis. So you see how maya is the word for muscle, or prefix for muscle, and then inflammation of. The reservoir is only humans, and it's very contagious, highly, highly contagious. It is spread through fecal-oral route, droplets, and aerosols, so saliva, and also through the intestines. So the disease, there's 3 kinds of poliovirus, mild to severe. Majority of people are asymptomatic or you have a diarrheal illness. So that's our fecal oral, kind of like gastrointestinal enteritis. And then a small percentage of people might have that travel to the nervous system. And then you have something called paralytic polio, and it can potentially lead to death due to that paralyzation of the respiratory system. The polio virus can invade the local lymph tissue, right? So any way that you get it into your body, gets into the bloodstream, and then it affects the cells of the nervous system. It actually replicates inside the motor neurons in the spinal cord, brainstem, or motor cortex. So these are all areas that have motor neurons. And that cell destruction leads to that flaccid paralysis. So we can't control our muscles, they are paralyzed, right? And then here we have that blurb on the respiratory system. And then again, just the mention of those positive pressure iron lungs that we saw in that first picture. This is images of the polio epidemic that we had in 1952 in the United States. There were 20,000 cases of paralytic polio. And the last case of wild polio was in 1979. There were no cases of polio in the Western Hemisphere since 1991. Okay, so the outbreak and the epidemic was so large and so scary, and it's also a worldwide virus, that a vaccine was produced against this virus. And that's why we have such low numbers now, that it's almost eradicated. So just like smallpox, the smallpox isn't, the variola virus doesn't exist in the population anymore. There's only 2 vials of it. Polio is what they wanted to do that to polio. So they're on the path to eradicating it from the planet. All right, so we need to know about these 2 vaccines that were created. The vaccines really made that worldwide difference in very intensive immunization campaigns using herd immunity as a tool. The Salk and the Sabin. Okay, so the Salk vaccine has the K in it, and it's the killed inactivated virus. So K for killed, right? It's killed. So this is an inactive virus that they give to people. And then the Sabin vaccine is a live virus. So it's an attenuated virus, but it's still alive. This dead one has to be given through a shot, just like we get any other vaccine that we know, right? Intramuscular shot. And the Sabin vaccine is an oral vaccine. All right, so there's pros and cons to each vaccine, and these were given together to eradicate polio, and then the United States doesn't use the live form anymore. It would use the killed form. However, so let's look at the pros and cons. So the killed vaccine, the pro is that there's no risk of transmissions to others or back mutation. If you have a living virus in your body, it's going to be shed in the same way that the live virus would be shed. You could give it to other people. And since it's very contagious, right? And the back mutation is possible. So because you have an attenuated virus, the attenuation, it's weaker, right? So there's a chance that the virus can mutate back into its virulent form. And that has happened. So the killed vaccine has no chance of that, right? You can transmit it there's no risk of transmission to others because it's dead. And it will not back mutate. It's also very effective in preventing paralytic polio, but it's the kind that's in the Salk vaccine does not protect against gastrointestinal polio. So that's sort of a con. And also another con is that the vaccine needs to be kept cold, and you have to have clean syringes and medical equipment, right, to administer it. The Sabin vaccine is a live attenuated virus. The pros are for those countries that can't afford the medical needles, the syringes, right? They can't afford refrigeration. Maybe there's very little electricity even to keep it cold. So the pro for this vaccine is that you can just give it to people, store it at room temperature. Very important for poor countries. Another pro is that it's effective against GI and paralytic polio. And if you get 3 doses of it, you're 98% protected. It has a 98% efficacy rate. The cons, obviously, we talked about, if you get a live attenuated virus, this can be shed in your feces of immunized people, and it has a potentially, you can infect other people because you have a live virus. And then that potential to back mutate into the virulent form is also dangerous. There's a few cases in the United States traced back to the Sabin vaccine. And so we switched to the Salk vaccine in 2000. But again, it doesn't exist in the United States at the moment. In 1988, the World Health Organization launched something called the Global Polio Eradication campaign, very similar to the smallpox, and they're basically wanting to eradicate polio worldwide. It's close, right? Polio is now only endemic to a few countries, Afghanistan, Pakistan, and Nigeria, where vaccination efforts have been basically stopped because there's a lot of military conflict or political instability there, so they're afraid to send healthcare workers into those areas. This is an image of paralytic polio. And this is Salk and Sabin, or Sabin and Salk. Who's who? Sabin is this guy, and this is Salk. The virus is pictured here. All right, our last sort of weird, interesting infectious particle here is going to be our prion. So the prion causes something called transmissible spongiform encephalopathy. It's a mouthful. Prion stands for proteinaceous infectious particle. and it was not too long ago when it was identified, so it's pretty new-ish. The words for the disease transmissible is because it can be transmitted from one person to another or an animal to another. Spongiform because the brain will have areas that will die, and those holes make the brain look like a sponge in autopsy. And then encephalopathy, so we know that encepha refers to the brain, and pathy, note that it's not itis, right? So we don't have a swelling, but pathy just means that there's some a pathology going on, there's some kind of disease going on, but there's no inflammation associated with it. So inflammation, if you think about it, really causes you to pay attention to that area of the body. It tells your body something's wrong because of the fluid there, the pain receptors that you're triggering with that swelling, all the white blood cells, all the vasodilation. So apathy is you have none of that, right? So you have no idea that you might have a prion disease going on in your brain. Kind of like Alzheimer's disease, where there's a pathological change, but you don't have any symptoms of it until you get those behavioral symptoms. So let's take a look at how it works. Your body in your brain has a normal prion protein. We all have normal prion proteins in the brain. Picture A here shows you normal. You might notice that the normal versus abnormal, there's a lot of curly, what we call alpha helices in this protein form. In the diseased form, the abnormal form of this protein, we have a lot of these smooth, they're called beta pleated sheets. So we're trading these curls in for these flat areas, and what that does is these flat areas attach to other misfolded proteins, and it can clump up and they form little plaques in your brain. So what happens is you have this endogenous PRPC. So this is normal. And then there is this abnormal prion protein that's basically in the wrong fold. How you get this in the brain is either spontaneously, just something happened, the protein folded the wrong way, and now we have the SC. So the SC stands for scrapie. Let me put that down. Scrapie is actually on the next slide, but scrapie is a disease in sheep. That's an A. That was first identified. So that SC stands for the abnormal shape of the protein. Or you can get inoculated with the abnormal form of the protein. How do you get inoculated? We eat the protein that's abnormally formed from an animal that's sick with this. Or you can convert, if a mutant gets into your brain, then the mutant has this way of interacting with normal prion protein and then forcing the normal prion protein to change shape into the abnormal form. So you have this chain reaction. Now you have two abnormal prion proteins. They're going to go on and convert other normal ones into the abnormal ones, and you get this accumulation of the sort of sticky, diseased shape of the protein. Here's another look at the pathogenesis. So here's our normal prion protein. It's a surface protein on our cells. Number two, the scrapie form can be produced by an altered gene. This would be the genetic form of it. You could also eat this, take it in orally from infected meat or food. Number three, it interacts. You can see that interaction here with the normal form of the scrapie, and now we have conversion into two abnormal forms. Those two abnormal forms then go and force the other normal forms to become abnormal, and all of a sudden we have a bunch of abnormal forms of this protein. Some of them will be engulfed into the cell, and then it can accumulate inside the cell. And then the cell will eventually die because of the buildup of those prion proteins. So the disease, this transmissible spongiform encephalopathy, is always neurodegenerative, so it's killing your brain cells, and it's also always fatal. And the scary thing about this is that there's no cure There's no medicine to slow down the progression of the disease. So transmission, ingestion of infected nervous system tissues, tissue transplants, blood transfusions, or contaminated fomites. You might think to yourself, okay, how do we get nervous tissue? I don't eat nervous tissue, right? How does nervous tissue get on maybe the muscle, right? A cow, a hamburger. Again, slaughtering, right? So when animals are slaughtered, nervous system tissue can contaminate the beef. So looking at the two forms of this TSE, we have a genetic form, right? So this is where that scrapie form just happens to be made. Unlucky. So there's two forms of this genetic disease. There's one called fatal familial insomnia, FFI. And that I have a little clip of this in the Canvas shell. I think it's really interesting to watch, but basically people who have this condition, and honestly, this is so rare that there's like one family in Italy that has this lineage of FFI. And you just can't go to sleep. It's very neurodegenerative, and people will end up like sleepwalking through life and ultimately die. Creutzfeldt-Jakob disease is spontaneous as well. They think it's genetic, where a person just comes, subject to the misfolded proteins, and it just basically grows in the brain. So this is called CJD. There's another video clip in Canvas on this one. The second kind of way that you can get TSE is transmissible. So this is the two I have bolded: bovine spongiform encephalopathy. So bovine refers to cows. So cows have this condition as well. It's colloquially known as mad cow disease. And this one had a epidemic in the late 80s and early 90s in the UK. And basically what they do sometimes is they take cows that are not behaving correctly. They might look a little sick, so they won't use it for the human food, but they'll use it for protein for other animals. So it's basically contaminated meat and bone meal fed to other cattle, and that transmitted that sick cow's nervous system prion to a bunch of other cows by eating it. And then there were 100,000 confirmed cases. This is just cows, all right, not people. And so in an attempt to stop the spread, they had to kill almost 4.5 million cattle were slaughtered because they're afraid of the spread of the BSE. What occurred in 95 was that the first death was a 19-year-old in the UK, and 178 people went on to die from the disease. The latest one was in 2016. So people did die from this mad cow disease. So we don't call mad cow in people mad cow. So the BSE, when it infects a person, it's called this. It's called variant, the V is for variant, Creutzfeldt-Jakob disease. So VCJD. And so you notice how this genetic form and this infectious form, it's the same progression of the disease. It manifests the same way, but it's just it's just different in how you contract it, right? This is genetic. This is through eating contaminated foods. There are other ones. So here's our scrapie, sheep and goats, right? That's where the SC comes from. That superscripts the protein. There's also something called chronic wasting disease that you see in deer and elk. And then there's a very specific Kuru disease in a small tribe in Papua New Guinea. And they practiced ritualistic cannibalism and specifically ate the brains of the people that died. So obviously great way to spread a nervous tissue disease. And that's an image. Ooh, this is an image of somebody with that Kuru. So Kuru means laughing sickness. So I would anticipate that the people would laugh uncontrollably. This is a look at the brain. So we have a normal brain here, and then we have those obvious air pockets or pockets where we have no tissue. And so that's the spongiform look that we would see in TSE. Okay, so most commonly we have these symptoms: memory loss, personality changes, blurred vision, uncoordinated movements, insomnia. Yeah, so ultimately deadly. All right, so on that note, we have our viruses. So we had our West Nile and Zika. We had our Creutzfeldt-Jakob disease, polio, rabies. We did not talk about this meningitis this time, but we did talk about Zika. All right, let's just finish this chapter. Fungal meningitis, the one we're talking about now is Cryptococcus neoformans. We talked about this one before. It's in soils, if you remember, very commonly associated with where you have pigeons and pigeon droppings. You inhale the spores. We talked about this in sort of a respiratory infection, but then if it becomes systemic and gets into the brain, it can cause, or the meninges, it becomes meningitis. So very rare in healthy adults. Okay, we don't have to be scared of this unless you are severely compromised, like an AIDS patient, then you're very susceptible to this. So antifungals, and I'm just not going to go into any more detail here, but antifungals, this is what I was talking about, is very hard to get through the blood-brain barrier. And antifungals, as we know, fungi are eukaryotic cells. And so the medicine to treat and kill eukaryotic cells are going to overlap with some toxicity to our own cells. So they can have very bad side effects. And for this reason, they want to use prolonged treatment with low doses of medication. So it can't get through very well. It has very bad side effects. You don't want to give a lot of it, right? So you have to do it for a long time at low doses. And from the image, you can see a huge capsule, right? A huge capsule, which is its main virulence factor in evading the immune system. All right, now we have an amoebic meningoencephalitis. This guy is also really, really nasty and very, very rare. This is a free-living amoeba that causes a rare and usually fatal, because it's so fast at its action, infection of the brain. And the way that you get it is unusual in terms of, like, this amoeba is going to be in the water, and it really likes warm water. Like, think about hot springs, or like a lake that has warmed up. It can be fresh or slightly salty. And most of them are in the natural waters. And so if you do go over the summer or whatever in your life, you go to hot springs, I would say don't put your head underneath the water, just get your body in there. The amoeba are usually forced into the nasal passages or sinuses by swimming, diving, jet skiing, like whatever drives the water up into your nose. And then from the nose, it has a passage into the brain, because we have those olfactory receptors for smell that are, those olfactory neurons are part of the brain, and they come into the nose through little holes in your skull, if you remember the cribriform plate. And so there is a passageway from the nose into the brain. Once it gets into the brain, it really just eats the brain. So rapid progression, massive destruction of the brain and spinal tissues. And then the symptoms, once you first get them, you could die within 3 to 7 days of those symptoms. So a lot of times when you go to the hospital, they don't know what you're suffering from. And so to give the appropriate care is sometimes not done. So treatment usually doesn't help, because once you have symptoms, it's already kind of too late because of the fast progression. And so this is your Naegleria fowleri amoeba that you can see here amongst a lot of neutrophils. And then you might want to buy these little nose plugs for the next time you go to a lake and want to do any diving. So to rest easy, Naegleria fowleri, the incidence is very rare. How does the risk of getting this infection compare with other water-related risks? And so 29 reported infections in the United States in the 10 years from 2013 to 22. And if you think about it, there's millions of recreational water exposure incidences, deaths in comparison. So in the same time frame, there were like millions of other waterborne or water related incidents. So yeah, anyways, it's not too bad in terms of being rare, but you do want to be careful about going in and getting the amoeba into your nose. All right, our last guy here is neurotoxoplasmosis. We did talk about Toxoplasma gondii as a fecal oral transmitted GI tract infection. We talked about how this had two different hosts. This parasite moves from the cat, which is the definitive host, to a mouse. And we talked about how this parasite is shed in cat feces, and pregnant women should never handle cat litter or cat feces because of this, because it can go through the placenta and cause the fetus to get infected. However, it does also cause neuronal damage. So in the immunocompromised, so you have to be immunocompromised. This disease is called neurotoxoplasmosis, and it causes brain abscesses. So it can cross the blood-brain barrier. Remember, it did cross the placenta, which is also similar in that the placenta has a barrier for a little stricter barrier for the baby. And it gets there by infecting those cells of the capillary of the brain, and then it basically reproduces inside those cells. When those cells break open, then they can reach the brain. This is a cyst. That's the Toxoplasma gondii forms, and those can form in the brain. So those would call those abscesses. And that is it, you guys.